dispatchers from the data jungle of COVID-19. After 90 straight days of leading a team to untangle the webs of pandemic data in all of its waking hours, William Duck finally teared up. But not from his own exhaustion. On August 21st, his last day in CDC's COVID-19 response, Will was saying goodbye to his IT team, who had volunteered to build from scratch the system that gleans numbers of COVID-19 cases, hospitalizations, and deaths. The hardships that they had endured in this struggle to put the system together made Will's emotions overflow. Will had joined the response on May 18th when CDC's COVID-19 case data system was new and still fragile. It had begun with sputters to produce data for CDC's internal use in April, but the crew had to work around the clock to process the information while patching barrages of system glitches with new programming codes. At the same time, CDC scientists urgently needed a robust team of daily data to analyze how COVID-19 was spreading and who was most vulnerable to dying from it. States needed the data to help them decide on measures to slow down COVID-19 spread, and news outlets pounded the table for CDC to publish totals of people who were sick or dead in the U.S. from COVID-19. If the data didn't make it out on a given day, we heard about it real quick, says Will. He was the Deputy of Data Science and Data Management for the Case-Based Surveillance section of COVID-19 Data Analytics and Modeling Task Force. The data originated from all 50 states and tribal regions. Between them, they had roughly 50 different methods of collecting and formatting the data, 50 legal policies on data, and 50 levels of detail on patients' age, race, and ethnicity, if they reported these details at all. Many states lacked ample staffing and IT infrastructure that was needed to gather and report on this data. One of the country's largest states had just one employee to coordinate the submission of COVID-19 case data from the state's regions and then sending that to the CDC. Will had walked into a data jungle with the job of farming it into rows of crops in just weeks. The data landscape was never consistent. One state managed COVID-19 data on 4 IT systems that did not talk to each other. Another state still used paper forms and had an incredible backlog to feed into their system. States were also not mandated to give us their data. They were sharing it voluntarily, Will says. When Will joined the team, his colleague, Casey Diebold, was devising an overarching coding concept to make the COVID-19 data from the 50-plus sources all align. Will was a good fit to hand off to because he had been fighting the same battle with public health data already for decades. Older state health data systems that don't align are the norm in the United States and urgently need modernizing into systems that will work together. The COVID-19 crisis simply exacerbated the weakness, says Will. Will, who normally works as a health scientist in CDC's Center for Surveillance, Epidemiology, and Laboratory Services, also known as CSELS. Based on Casey's concept, Will's data management team continued ironing out misaligned data while building an algorithm that would take over most of the task. Will says that the process took 6 intensive weeks. While they coded, snags kept coming up. Some states, without notifying the CDC, reformatted their state identification codes, triggering avalanches of duplicate COVID-19 cases to be fed into the CDC's system. Suddenly, data submitted from one state showed 1,800 infants had died. We got with our task force state coordination team, and with the state, we figured out that these birth dates were off by a century. These patients were born in 1919 and 1920, not 2019 and 2020. It took 3 team members weeks to fix the problem, Will says. In June, a new problem threatened to derail the project. During Will's stint, about 100 volunteer coders cycled through his response team, all working together night and day. Overtime added up to the person weeks, and the pool of coders ran low, while work piled higher than ever before. We were forced to automate manual data tasks, or we weren't going to be able to handle the workload, Will says. Will helped establish a new team to automate the pipeline and continue to refine it. And just after they began the work, August 21st rolled around, along with Will's heartfelt goodbye via a webcam. The next day was Will's birthday. Will woke up that morning, looked at the clock, and fell right back to sleep.